So if you're an athlete, you just recently torn a ligament, you have some recent injuries, yes, you might want to consider getting it done because it's a very early stage. You might want to help facilitate the growth, the repair. You want the platelets to work. Now, if you're somebody who's like very late stage, and I do see patients who have very late stage arthritis that's significantly degenerated, at that point, I don't really think you're going to be doing much by throwing in these growth factors, because really, how much repair can you get?
Yeah.
Now, there's one study, though, that they found that looking at what we call tennis elbow, lateral epicondylitis. So if you look at your arm, it's on the outer aspect of it. For classically happens when you play tennis, but it could happen doing anything. Exactly, it could even be a short order cook on a line cook. You know, I've seen folks with that. But regardless, PRP appears, there's some data showing that it does appear to work for that particular condition. And so the nice thing, though, is PRP is pretty much a safe option for a lot of folks. Why? Because they're taking your own blood, so the chance of having outside contamination is very low. So it's your own blood, you're not going to have a reaction to it, or should not have a reaction to it. But you might have a little bit of skin irritation, you might have some bleeding, but really it's very, very minor. So it's really pretty low risk of harm on the scale thing. So